And joining me now is the most trusted figure in the country on this subject. It's Dr. Anthony Fauci. He's the director of the National Institute of Allergy and Infectious Diseases. Dr. Fauci, welcome back to Meet the Press.
Thank you, Chuck. Good to be with you.
A year ago, literally this date, you were out there warning us. We were all contemplating how bad this would be. But I don't think any civilian thought, oh, this is going to be a year at the time. What would you tell yourself from a year ago of what to expect, and how shocked have you been about what this year's been like?
You know, Chuck, I knew it was going to be bad, and, just a couple of days ago last year, I said at a congressional hearing that things were going to get much worse before they got any better. But even I did not fully anticipate that we would have over 500,000 deaths a year later. We knew it was going to be bad, but this really has turned out to be just a historic example of what a pandemic virus can do. It's just been a terribly trying year for everybody in so many respects, not only suffering health-wise and deaths and loss of loved ones, but what it has done to society, to the economy, and how it has kind of deepened some of the divisiveness that we've had in our country to begin with. It's just made it even more intense. It's just been a bad time all around. We're getting around the corner. Right. We're going in the right direction. But boy, looking back at what we've been through, people are going to be writing about this and historically opining about it for a long time to come.
When you think about, sadly, having to prepare for this again, right? And I know there's a lot of folks who think that, due to climate change and due to the globalization in general, it's inevitable we're going to deal with more and more viruses like this. The biggest lesson you're going to take away to prepare for the next one?
There are a couple of lessons, Chuck. There are lessons domestically. There are lessons public health-wise, scientifically. Let's take global to begin with. We have to have a better global health security network of interconnectivity, of communication, of transparency, so that we are talking to each other all the time and know what's going on. We also have to have a continued investment in the science. If you want to look, Chuck, at the success story in this terrible year has been the extraordinary, unprecedented advance with the vaccine, where, in January of 2020, we started the process, and 11 months later, we had a highly efficacious vaccine going into the arms of individuals, which is going to be the answer to this, together with public health measures. So keep the science up, continue to support the public health infrastructure, and remain global in our interactions. As I've said so many times, a global pandemic requires a global response.
Let me go to what the president said on Thursday night and the dual promises about the month of May. With promise one on May 1 being everybody is eligible to get on the list, and by the end of May, anybody that wanting a shot gets there. Why are they? I know that he's not saying those goals without talking to you. Why do you feel those are achievable goals?
Well, they're achievable, Chuck. If you look just at what's happening, what the president has done is he's done a number of things, but two major things is he's gotten us a much larger supply of vaccine. He negotiated with Moderna and Pfizer to get an additional 100 million doses each from the companies. We had a contract with J&J to have 100 million doses. We've negotiated yet again another contract for an additional 100 million doses. That's the supply. Then there's the issue of getting it into people's arms. And that's where we've mobilized the community vaccine centers, the community health centers, pharmacies that are going to be getting it, mobile units that are going to be putting into areas that are poorly accessible, and mobilization of a lot more people are going to be doing the vaccinations, from the military to volunteer, retired physicians, nurses, and other healthcare providers. So, that's really a full court press, and that's the reason why we're going to be, at least a couple of months ahead of where we thought we would be.
What worries you that could prevent us from meeting that end of May goal, that everybody that wants a shot will get their shot?
Well, I don't think there's much that's going to prevent us from having quantitatively the number of vaccines that the president promised. That, I think, would only be if there is a major production glitch. Those things happen. You can't guarantee 100% that they won't. More of a concern that I have, Chuck, is that we'll have what's called variant increases, where you may have another surge. And if you look at the numbers that have gone down, they've gone down so nicely in a very steep decline.
Yeah.
But in the last couple of weeks, we've had a plateauing of infections. And the thing that concerns me, because history it proves that I should be concerned, is that when you get a plateau at a level around 60,000 new infections per day, there's always the risk of another surge. And that's the thing we really want to avoid, because we are going in the right directions. That's why I get so anxious when I hear pulling back completely on public health measures, like saying no more masks, no nothing like that. I mean, that is a risky business when you do that.
I was going to ask you on your level of concern of a new surge, because you want to talk about a version of PTSD for many people. When we see Europe on the uptick, we see Italy locking down again. That's very familiar, sadly. And every time Europe upticked, it was about 2 or 3 weeks later, and so would we. How do we make sure that doesn't happen again?
You know, Chuck, it's exactly what I'm saying, that even though the decline was steep, we absolutely need to avoid the urge to say, oh, everything is going great, which it is going in the right direction. But once you declare victory, you know, that metaphor that people say, if you're going for a touchdown, don't spike the ball on the 5-yard line. Wait until you get into the end zone. And we're not in the end zone yet. And that's one of the issues, that when you plateau, there's always the risk of a surge. That's exactly what the Europeans have experienced.
I want to talk about vaccine hesitancy here, because we're noticing something, at least in polling, that it is not the conventional wisdom about vaccine hesitancy that you see this divide by race. We're seeing a bigger divide by politics. We talked about it earlier. For instance, among Trump voters, 47% have said that they will not be vaccinated. 30% say yes. Among Biden voters, 58-10. Among Republican men, half of Republican men say they're not going to take this vaccine. You have the PSA with all the former presidents except one, President Trump, in there. Do you think he needs to be enlisted here at all to get his voters to take this vaccine?
Chuck, I hope he does, because the numbers that you gave are so disturbing, how such a large proportion of a certain group of people would not want to get vaccinated merely because of political consideration. It makes absolutely no sense. And I've been saying that for so long. We've got to dissociate political persuasion from what's common sense, no-brainer public health things. The history of vaccinology has rescued us from smallpox, from polio, from measles, from all of the other diseases. What is the problem here? This is a vaccine that is going to be life-saving for millions of people. How some groups would not want to do it for reasons that I just don't understand. I mean, I just can't comprehend what the reason for that is when you have a vaccine that's 94 to 95% effective, and it is very safe. I just don't get it.
Well, hopefully your words here will help on that front. Let me talk about the AstraZeneca vaccine. It is not one we've approved in this country, but there are AstraZeneca vaccines that are ready to go, that can go to other countries that have approved it. We know Europe is dying for some more vaccines. President Biden is not ready to release it yet. Why?
You know, Chuck, I think there's a misunderstanding there. There isn't this whole backlog of vaccines that are ready to go somewhere into somebody's arms, either here or overseas. I think people are getting the wrong impression about that. The president has made it clear that obviously the first preference, because of the extraordinary suffering that we've had with over 500,000 deaths thus far, that we want to make sure that people in the United States are covered. But it's very clear that he fully has the intention of getting vaccines shipped to other parts of the world that don't have the resources that we do. And we've already made the commitment for $4 billion that will go to COVAX.
Yeah.
So I think people might be getting the wrong impression that we're holding back doses, which we really are not.
Well, then what are we going to do with these doses?
Well, there aren't a lot of them. I think people think that there are a lot of doses. I mean, I don't know exactly how many, but they're not anything that's going to be major impact. There will be, but not right now.
Okay. And very quickly, we know President Biden said at backyard gatherings. I've got a staffer or two that wants this question asked of you, and I'm sure they're not alone, which is, when can people plan an indoor wedding?
You know, that's a good question. And I think that's going to be within a reasonable period of time.
This
you
calendar
notice
year?
what the CDC is doing. They gave, excuse me, I didn't hear what you said.
This calendar year?
What time of the year? I can't give you that exact date because it's going to absolutely depend. And this gets back to our conversation a minute or two ago. It's going to depend on the level of infection in community. If we plateau and stay at 60,000 a day and go up with a peak, I mean, you can make no prediction. If we keep going down and get to a very, very low level, when we're there and we have a good proportion of the people vaccinated, I think you're going to see weddings in the normal way that we've seen it within a reasonable period of time. But there's always the caveat that it's not going to happen if all of a sudden you have a surge.
So be careful in the next month or two for sure anyway. Dr. Fauci, as always, sir, thank you for coming on, sharing your expertise with us and viewers.
Thank you for having me, Chuck.
Hey, thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.